Good morning, everybody. And I apologize for the slight delay due to a technical glitch. On the eve of World Stroke Day, we are happy to bring you today's webinar on stroke awareness, recognize the signs, respond in time, with medical experts from Kauvery Group of Hospitals. As we all understand, a stroke is a time-sensitive medical emergency where every minute counts. A prompt recognition of the early signs and a fast response can help to reduce brain damage and improve the chances of better recovery. Today's session aims at creating awareness on every critical aspect of stroke, the treatment options, and lifestyle measures for better health, for better brain health. As part of the Hindu's Wellness series, this webinar is presented by the Kauvery Hospital, and I'm your host, Shoma Basu, taking it forward. You can see the three panelists on your screens, and let me begin with the introduction of Dr. K. Subramanian, the clinical lead and senior consultant neurology at Kauvery Hospital, Radial Road, Chennai. Dr. Subramanian is an experienced neurologist who completed his MBBS and MD in internal medicine from Stanley Medical College and DM in neurology from Madras Medical College. Prior to his present job, Dr. Subramanian worked as professor and head of department at Chettinad Medical College and Super Speciality Hospital, and he was also at Miot and Rela Hospitals as senior consultant and HOD. Neurocritical care, stroke, headache, nerve muscle and movement disorders, epilepsy, infection of the central nervous system, neuroimmunology, and neurorehabilitation are his areas of specialization. A member of the Indian Academy of Neurologists, the Association of Physicians of India, and the Tamil Nadu Neurologist Association, Dr. Subramanian has authored many chapters in medical books and published several articles in national and international journals. Known for treating innumerable critically ill patients, he has also trained many postgraduates in the super specialty course. Dr. Subramanian will introduce the topic of today's webinar, stroke and its symptoms. So welcome, Doctor.
Good morning, everyone. I'm Dr. Subramanian, Senior Consultant Neurologist, Kauvery Hospital, Radial Road, Chennai. Okay. So today I am going to talk about stroke awareness. The World Stroke Day is tomorrow. So we thought we'll create some awareness among public regarding stroke. So we took this initiative and we are planning to bring out some more. So with this short introduction, I am going to talk about my topic. Okay. So my flow is going to be like this. So what is stroke? How stroke happens and types of stroke and what are the frequent symptoms in stroke and why we need an awareness for stroke. Okay. So 1 in 6 people worldwide will have a stroke in their lifetime. Remember, this is very important. That means the incidence of stroke is very high. So what is stroke? Stroke is a serious medical condition that occurs when the blood supply to the brain is disturbed. This may be either a block in the blood vessel or there may be a bleeding inside the blood vessel, bleeding from the blood vessel. So there may be, this can also produce damage to the brain. So there are two major types of stroke. One is due to a block in the blood vessel and the other is due to bleeding. This is due to a rupture in the blood vessel. Okay. So now you see a picture with a clot inside the blood vessel, and this has produced an area of damage in the brain, which is highlighted as a dark shadow. Okay. So going into the Symptoms. There are plenty of symptoms which one has to be aware. So usually stroke presents in many ways. Uh, the common presentations being limb weakness and then the facial droop and then the slurring of speech. So these are all the common presentations which we see daily. So types of stroke. There are two major types of stroke. One is an ischemic stroke, another is hemorrhagic stroke. So ischemic stroke is again divided into thrombotic stroke and then embolic stroke. And thrombotic stroke again further divided into it is large vessel thrombosis and a small vessel thrombosis. So another form of major stroke is hemorrhagic stroke, which will be treated by the further speakers. Okay. So the incidence of ischemic stroke is very high compared to hemorrhagic stroke. Okay. How an ischemic stroke occurs? This is in general. So there is a formation of clot inside the blood vessels. You see a red colored clot inside the blood vessel. This clot blocks the blood flow. Depending on the severity of the clot, the blood flow is either impeded or it is totally stopped. So depending on this, we do get clinical manifestation. So the clinical manifestation depends on the severity of the block and then the area in which the clot has occurred. So this is a traumatic stroke. Traumatic strokes occurs in a large vessel as well as in a small vessel. So usually this thrombosis occurs in a diseased vessel. Why the vessel gets diseased? So there are many causes for the diseased vessel. The commonest being the atherosclerosis. So the atherosclerosis can occur in patients with diabetes, hypertension, and smokers. So these are all the common predisposing factors for an ischemic stroke. So what is an embolic stroke? Embolic stroke is there is a clot formation somewhere which migrates to the brain. So usually it occurs either in the heart or in the major neck vessels. Because of the local disease, the clot formation occurs in the neck or in the heart and it migrates to the brain, producing clinical symptoms. So hemorrhagic stroke is a type of stroke which will be done by Dr. Madhusudan. So what is transient ischemic attack? Transient ischemic attack is a reversible process. So some people they experience stroke-like symptoms which clears quickly. The duration is usually minutes and it can last up to 24 hours. So some they may say that they have paralysis or a numbness in one side limb which lasts for few minutes and then subsided. Many times we do get this kind of response from people. So this is the TIA. So why TIA is very important? TIA is a forerunner for stroke. So you have to aggressively treat the TIA. So TIA can occur if the blood vessel is narrow. TIA can occur if the patient has heart disease. So embolic strokes can initially manifest as TIA. So now the burden of stroke. In India, brain stroke is the third largest killer after heart attack and cancer. And the estimated prevalence in India is about 203 per 1 lakh population. The problem is in India is 12% of the stroke occur in populations below the age of 40 years. So this is very important because this is the prime age of a human being. So if a person is affected by stroke at this age, it is going to be devastating to the family. So, what are all the symptoms which we have to watch in a stroke patient? So, I have given a picture. So, there may be problems in speaking and understanding what others speaking, and they can have a confused speech. So, these are all problems related to speech center. So, they can even have mild forms of speech abnormality like a slurring of speech. So this varies from slurring of speech to severe form of speech disorders like patient cannot talk at all. So this is regarding speech. And then regarding limbs, they can have weakness or numbness, especially on one side of the body. And then they can present with giddiness and then problems in walking and falls. And they can also present with problems in vision, like they can have loss of vision or diminished vision in one eye, and they can have problems in both eyes also. And headache. Headache is also a common accompaniment of stroke. Usually it occurs in an hemorrhagic stroke. The incidence of headache is very less with an ischemic stroke. Okay, why we are here? So we are here to discuss all these problems. So stroke, what are all the disabilities we see after 6 months of stroke? So commonly they are left with weakness of one side of the body, which is 50%, and then 30% needs assistance to walk, and 26% are dependent on other people for daily living, and then they have severe form of speech involvement. In 19% of the people, they can have speech problems. They may not be able to even speak. And there is always an association with depressions, especially when people who are very active, when they land up in stroke, they go in for severe form of depression. And then 26% of people, they require hospital care, in hospital or a nursing home care for their future. So these are the warning signs which I'm going to discuss, which everyone should know. So any sudden onset of numbness or weakness in face, arm, or leg, one side of the body is a warning sign for stroke. Similar to that, we have sudden loss of speech and trouble speaking, like slurring of speech, or misunderstanding problems, like may not be able to understand what other people are speaking. They can have sudden vision problems, like what I told before, like problems with vision in one eye or both eyes, and they can have sudden unexplained dizziness, unsteadiness, or sudden falls, especially with any other symptoms like weakness, and then sudden severe headache with no apparent cause. So previously, patient was not having any headache, and this is a lifetime first severe headache. This needs evaluation. This can be a hemorrhagic stroke. So this is the acronym which we commonly use. So FAST. The FAST is problems in face, like face drooping or deviation of mouth to one side, arm weakness, which may be mild or severe, may not be able to hold a pen, may not be able to hold a tumbler, then speech. This may be either mild forms like slurring of speech to mute stage. So these are all major symptoms of stroke. So when you see this, you have to act fast. T is the time. So you have to, time is brain actually, and you have to go to the nearest hospital immediately, preferably a hospital with stroke unit. So after fast, we are left with some other clinical manifestations like balancing problems, and then eyes. So they added both this because they want to cover all these symptoms into stroke. So now fast will become be fast. So B is for balance. If there is any problem in balancing, unsteadiness while walking, so still it could be a stroke. And then problems with your eyes, either loss of vision or if there is an abnormal eye movements, all these points that we may dealing with a stroke. So with this brief introduction, there are some points which has to be remembered. Remember, 1.5 to 2 million neurons die every minute when blood supply to some part of brain is cut off. This is very important. Each and every minute counts. So act fast to save relatives, friends, and neighbors. There are stroke call centers which are available. You can call them and then ask for help. They can send ambulance or they can guide you to your nearest hospital. So always prefer in hospital with CT MRI facilities and stroke unit so that you can save a lot of time as well as life. Thank you very much.
Thank you, Dr. Subramanian, for the crisp presentation. We now move on to our next speaker, Dr. K. Madhusudan, Consultant Neurosurgeon, Cantonment Trichy Branch. A consultant in brain and spine surgery and with extensive clinical experience, Dr. Madhusudan completed his MBBS at Madras Medical College, followed by an MS at Madurai Medical College, and returned for his MCH in neurosurgery to Madras Medical College. A practicing neurosurgeon since 2011, Dr. Madhusudan is proficient in trauma care, complex spine surgery, skull-based surgery, and minimally invasive techniques. His scholarly work includes research on metastatic brain tumors, coagulation abnormalities in head injury patients, and advanced neurosurgical techniques. Besides a robust neurosurgical practice, Dr. Madhusudan's areas of expertise also include functional neurosurgery, navigation guided tumor surgery, and neurovascular surgery. He has professional memberships in the Neurological Society of India, the Association of Surgeons of India, the Indian Medical Association in Trichy, the Neurotrauma Society of India, the Neurosurgeon Society of India, and the Tamil Nadu Association of Neurosurgeons. Welcome and over to you, Dr. Madhusudan, for your talk on hemorrhagic stroke.
Morning all. It's nice to meet you all people. So my topic today is hemorrhagic stroke. So just now we heard sir giving an introduction about the ischemic stroke, and what I will be talking about the hemorrhagic stroke. So what happens in ischemic stroke? There is a stop in blood circulation to the brain and which produces cell loss, neuronal cell loss. What happens in hemorrhagic stroke? There is an excessive blood flow which causes blood vessels to break and it causes bleeding inside the brain. That is we call as a hemorrhagic stroke. So in crisp, what happens in a hemorrhagic stroke? So we have built dams across rivers. When it is a controlled flow of water, nothing happens. When the dam breaks or when there is a flood, there is an excessive flow of water which destroys everything along its path. That's what exactly happens in a hemorrhagic stroke. So there is an excessive flow of blood and the blood, whatever it goes through, damages the brain tissue, and that's what happens in hemorrhagic stroke. So what are the symptoms? Sir Balasubramanian sir was talking about the BFAST symptoms. So what is the difference between any difference in symptoms between hemorrhagic stroke and ischemic stroke? Not much. Like the same symptoms, like difficulty in balance, difficulty in vision loss, face drift, difficulty in or arm weakness, speech difficulties, and whatever these things be fast, we have to add very fast. There is not much difference between an ischemic stroke and a hemorrhagic stroke. What one thing is very catchy about the hemorrhagic stroke is the headache. 90% of the time, a sudden severe headache happens in hemorrhagic stroke more than in ischemic stroke. So everyone gets a headache. What are the red flags in headache which you have to be very careful about? So when these red flags are present, it can be a sign of hemorrhagic stroke. The headache is a sudden severe headache. So usually what headache we usually get, headache starts at a mild level, it usually picks up and it becomes severe. Whereas in a hemorrhagic stroke, the headache is called a thunderclap headache. So it strikes you like a thunder. It starts very sudden and it goes to the severity immediately. And associated with it, if there is weakness, difficulty in speech, vision problems, loss of balance, and nausea and vomiting, and if there is a loss of consciousness, associated with severe neck pain or seizures, these are the red flags about the hemorrhagic stroke. So, what are the risk factors of stroke? Any stroke, whether it be a hemorrhagic stroke or an ischemic stroke, the risk factors are the same. Obesity, high blood pressure, high cholesterol, heart disease, diabetes, smoking, heavy alcohol use, lack of sleep, stress, and lack of exercise. What is more in hemorrhagic stroke? What are the add-ons or the uncontrolled BP or people on blood thinners? Lot of time we have seen patients who are on BP medications, the BP will be still uncontrolled. So they have a risk for hemorrhagic stroke. The other set of people are there, they will be on anti-BP medicines, they will be taking antihypertensive medicines. But over a period of time, they feel like their BP is controlled. So they stop the medicines abruptly and they don't follow the physician advice. So this irregular people, the people who take medicines irregularly or stop without proper controlling of BP or are high risk for developing intracranial hemorrhage, that is hemorrhagic stroke. So this is a CT that goes shows you the white thing, that is the hemorrhage. So whenever you reach a hospital, our primary role is to do a CT or an MRI to rule out an ischemic from a hemorrhagic stroke. Ischemic stroke, the treatment differs, and hemorrhagic stroke, the treatment differs. This is one type of bleeding which we call as a subarachnoid hemorrhage. This also happens after a thunderclap headache. So that happens with patients with aneurysm. What is an aneurysm? So aneurysm is nothing but a swelling in the blood vessels. So we need blood vessels to supply the brain. So when patients are having uncontrolled BP or some people for congenitally, there is a weakness in the blood vessels which will cause the swelling in the blood vessels, which you call it as an aneurysm. Sometimes the swelling bursts like a balloon. So it bursts and that causes bleeding in the brain. So this is called aneurysmal bleed, which causes a subarachnoid hemorrhage. And some people will have malformations, which we call it as an arteriovenous malformation. So what are they? We have the arteries for supplying the oxygenated blood, good blood to the brain, and we have the communications, and then we have the venous side. Venous side, they carry the deoxygenated or the bad blood away from the brain. So they are small connections between the arteries and veins. When these connections become abnormally large, we call it as an arteriovenous malformation, which can cause bleeding inside the brain and cause hemorrhagic stroke. So, how we are going to treat? In a nutshell, mostly in hemorrhagic stroke, we treat the patients medically with aggressive control of BP. Once in certain cases, once after the control of BP, if the bleeding is very large, we may need to do surgeries, and nowadays we do it mostly endoscopically or with minimally invasive approach. So this, I was talking about the aneurysms. They are the bulb-like things in the blood vessels which rupture and bleed. So our primary goal is to stop the bleeding, which we either do by two procedures. Either by a craniotomy, we open the skull and we clip the aneurysm. We apply a clip and stop the bleeding, or we do an angio, like how they do it for cardiac heart diseases. We do an angio, pass a catheter, and do a coiling within the aneurysm and stop it from bleeding. So these are the two options which you have for aneurysmal bleed. And this I have named as a benign bleed. So it doesn't present. See, usually any stroke presents abruptly. Lot of people ask me, sir, I have been having these symptoms for quite some time. Can I have a stroke? So usually stroke happens abruptly, except for this type of bleeding, which we call it as a chronic subdural hematoma. which happens in patients taking blood thinners. Usually, the symptoms are gradual onset and progressive, and usually it presents with weakness, slurring of speech, similar to an acute ischemic or an hemorrhagic stroke. Usually, we do surgery for this chronic subdural hematomas either by a burr hole or by an open craniotomy. So, what is the take home message? In hemorrhagic stroke, if you want to prevent an hemorrhagic stroke and if you are a known hypertensive patient, please take medicines regularly. Don't self medicate or stop treatment. That your BP has become normal with medication doesn't mean you are cured of hypertension. Don't stop your treatment or self medicate because that is the highest risk for having a hemorrhagic stroke. Maintain a general health. Have adequate 6 to 7 hours of continuous night sleep. Do yoga or meditation. Have a general health, like do exercise, go for walking, gym, or do whatever that is to maintain a physical health. Do yoga or meditation to maintain your mental health is also very, very important. Take good balanced diet, that is also very, very important. And patient on blood thinners, you need to be precautious. So nowadays, a lot of patients are taking blood thinners like aspirin, propylene for cardiac diseases. And you have to be very precautious that in elderly people, we are also having programs to avoid frequent falls. So you have to be precautious to avoid any injury. So and remember the red flag signs. Any early morning headache or wake up headache can be a sign of stroke. And remember thunderclap headache, that it strikes like a thunder. So it can be a sign of intracranial hemorrhage. And be fast. Remember, be fast. If there is disturbance in balance, disturbance in vision, disturbance like facial symmetry, arm weakness, speech disturbance, it is time to act fast. The goal for present 2025 stroke day is every minute counts. That's what every minute counts in stroke. So it's better be safe than be sorry. That's what I want to say. And if at all you get a headache, that is also very important. You need not get very anxious. Not every headache is a stroke. So remember the red flag signs and better be safe than be sorry. Thank you.
Thank you, Dr. Madhusudan, for that very detailed explanation on types of strokes. Before we move on to our third and last speaker for today, I would request our audience to start posting their questions in the Q&A box that is open now. Dr. Divya Selvaraj, consultant neurology and neurosciences from Kauvery Hospital, Salem, did her MBBS from Stanley Medical College, Chennai, MD from Madurai Medical College, and DM from Government Medical College, Salem. She has also done multiple specialty training programs with NIMHANS, Bengaluru, Thompson Jefferson University, Philadelphia, and the American Institute of Balance. Dr. Divya had held multiple proficiencies during her academic career and over the years has published several papers in medical and international journals. A member of the Indian Medical Association, the Indian Academy of Neurology, and the Indian Academy of Pediatrics, her areas of expertise include stroke, movement disorders, epilepsy, and neuroimmunology. She will now give a presentation on management and prevention of stroke. Welcome, Dr. Divya.
Thank you for the kind introduction. Actually, I'm very privileged and I feel very happy to be a part of this stroke awareness campaign. It is the need of the heart. Yes. Means so we have already seen what is a stroke, what are the types of stroke, and what are the risk factors, and few management points on hemorrhagic stroke. Now we will move on to management and prevention of stroke. So first, before scaring you all people with stroke, first we should understand the basic nature of the human brain. It is such a complex organ created by the nature. It has billions of neurons, but that does different functions. Unlike other organs, where all the heart cells uniquely function in pumping and all the kidney cells uniquely function in excreting. Unlike that, brain has multiple functions like thinking, remembering, understanding, planning, reasoning, problem solving, etc. So all these functions are situated in different areas in the brain. How a stroke can affect you? So the brain has been divided into two hemispheres like right and the left. A stroke on the left side of your brain can cause weakness and loss of sensation on the right side of the body. And the predominant function last when you have a stroke on the left side is your speech and language function. Similarly, when you have a stroke on the right side of the brain, the opposite side of the body will have weakness and loss of sensation. And the other associated problems may be vision problems, depth perception problems, and emotional lack, like creativity, music, those areas may be affected when you have a stroke on the right side of the brain. The effects of stroke depends on various factors like the region of the brain that is affected, the size of the area that is damaged by the stroke, and functions that the damaged area controls, as we discussed now. So again, to recap, stroke is also called a brain attack. Though the awareness for heart attack came much earlier, any people, if they have chest pain, suddenly they will rush to the hospital and check whether they have heart attack or not. Similarly, the stroke is also an emergency. So we need to be aware of the symptoms of stroke and rush to the hospital immediately. Managing stroke is a race against time. As already we said, time is brain. Every minute, 2 million brain cells die during stroke. Supposedly, if you come to the hospital within 10 minutes, the area of the brain damage will be the area that's shown in the red color. And the green area is the salvageable area. So if you reach late, like 1 hour, 3 hours, the area of the damaged brain increases and the probability of say salvageable area is minimal. So when you come beyond that hours, we cannot save any part of the brain that is being damaged. So the first step in managing stroke is to identify a stroke early, be it the patient himself, his relatives, or any bystanders, those who pass by that side. If they witness any of these signs, like balance, eyesight problem, facial deviation, arm weakness or numbness, speech delay or speech problems, you should act immediately. You can call to the emergency or admit them to the nearest hospital, preferably a stroke care center. So the step 2 is reaching the nearest stroke care center and minimizing the delay in the transport. This is the second cardinal thing you have to do. First, you have to recognize a stroke and then immediately reach a nearest stroke care center. Then once you reach the emergency team, they will assess you when the symptoms started, brief your medical history, and they will have your examination, physical and neurological. They will order some blood test and immediately shift you to the scan. What we do in a stroke care center is the minimizing the delay in the diagnosis and the treatment. Within 10 minutes of a patient arrival, his neurological examination will be done, his blood sugar, ECG, and oxygen saturation, blood pressure, everything will be checked, and immediately he will be shifted to the scan, either CT or MRI, depending on the patient's condition. The stroke team will be activated within 10 minutes of patient arrival. This is the crucial step. Why we are hurrying in this? Because there is a timely intervention available now. The time window for IV injection thrombolysis is up to 4.5 hours from the onset of the symptoms in eligible patients. So we are trying to reduce the time from the patient coming to the hospital and administering the drug. As we already discussed, once you are assessed, then you will be shifted to scan. If there is bleed in the scan, the treatment protocol is different, as already discussed. And if there is no bleed, and if the time duration is less than 4.5 hours, we can administer clot busting drugs like recombinant tissue plasminogen activator if there are no contraindications. And the time, if it exceeds 4.5 hours, there are interventions like mechanical thrombectomy. So, as I told, this is the injection given in the intravenously for thrombolysis, and if it fails, the next step will be this thrombectomy. This is a procedure where a guide wire will be inserted through the vessels and the clot will be retrieved from the brain. So, what are the factors we commonly see due to why we are not able to do these procedures in some patients is that patient care related. First, they will not recognize the stroke early and they will not bring the patient timely to the hospital. After reaching the hospital, there may be a BP shoot up. We need to reduce that before thrombolizing. And if the patient is not stable, we have to intubate them before shifting to the scan. And family related factors like the family may keep on thinking or discussing with someone to take a decision for thrombolysis or thrombectomy. And facility related, some patients may have heart problems. So sometimes we need some blood results to be known before thrombolizing the patient. So once done, either thrombolysis or thrombectomy, the patient will be admitted to the stroke care unit or intensive care unit, and the following things will be followed under careful observation and monitoring for the next 24 hours. This is about the management part. Now coming to the prevention of stroke, this is the most important part. As already told, prevention is better than cure. There are some risk factors for stroke, non-modifiable and modifiable risk factors. Non-modifiable risk factors are like your age, family history, race and ethnicity. As age advances, the risk of stroke increases. Gender, women have a lower risk than men before menopause. And prior history of any stroke or transient ischemic attack also a risk factor for stroke. So these you cannot modify. This naturally it will go on. When compared to coming to modifiable risk factors, there are medical and lifestyle risk factors. Medical risk factors are your high blood pressure, diabetes, high cholesterol levels, cardiac problems, and circulation abnormalities. When coming to the lifestyle risk factors, use of smoking, alcohol consumption, obesity or overweight, decreased physical activity, and not eating a proper diet. These are the risk factors for stroke. So one should concentrate on these risk factors. These are the modifiable and the patient-related risk factors, so that if you act now, you can prevent a stroke later on. You have to have a brisk 30 minutes walking each day. That will improve your daily health. Aim for at least 150 minutes of moderate to vigorous intensity physical activity every week. And eat healthy diet rich in fresh fruits and vegetables, whole grains, and include a lot of proteins. Limit the salt intake and added sugar intake, and avoid fried foods. Now we see most commonly the obesity and excessive weight is very prevalent from the younger age, like children. They have to be actively involved in some sports, some or other sports from the very beginning of their childhood. So in a nutshell, whatever the risk factors told so far is described as life's essential 8, like quit smoking, proper sleep, healthy foods, exercise every day, keep the blood sugar and pressure and cholesterol under control, check your weight regularly. 10 risk factors for stroke. Again and again, we are emphasizing this because this is the only thing you people can do to prevent a future stroke. So this high blood pressure, diabetes, high sugar, high cholesterol, heart problems, your doctors can modify if you have a regular visits. And this physical inactivity, poor diet, poor sleep, smoking, alcohol, and other drug abuse, obesity, and high stress levels, patients can modify these risk factors. So again, emphasizing the same thing, have regular medical checkups and take your medications as prescribed by your doctor, and reduce your stress levels, which will lead on to your behaviors like overacting, overeating, lack of physical activity, unhealthy diet, and smoking. So to end this year, World Stroke Day theme is every minute counts. Tomorrow is the World Stroke Day to create awareness among you people. Time lost, once lost is brain lost. So every minute, even every second counts. Act fast. Yes, you should also act, not only the medical professionals. Patient needs to act to recognize a stroke early and bring them to the stroke care center immediately. Thank you.
Thank you, Dr. Divya, for sharing those valuable information. I would like to ask the panel, is it possible to have a stroke without realizing it also? I mean, is there something called a silent stroke? And then, what is the time span? Like when does a patient get to know? Dr.
As we discussed this,
Subramaniam, would you like to?
Yeah. We do see silent stroke, especially during night hours. People go to bed normally, and then when they wake up, or usually the attenders they see they are lying unconscious, or they have fallen in their room, and they're not able to move their limbs. Again, it is a very tricky situation. Uh, Very difficult to identify the time of onset of stroke. In that case, we go by imaging. So generally, these kind of patients, we do an MR instead of CT, so that we can find out the duration of the stroke. Based on that, we whether the clot buster is needed or mechanical thrombectomy is needed, we decide. So it's usually imaging which decides the duration.
I'll start taking questions because quite a few have come up. Swati K is asking that she says her father is 65 years old and was an extremely active businessman, and he had double stroke attack. So how to know if it is genetic? Because most of her family members have had stroke, and also she wants to know how to keep him active and engaged within the home, and how to prevent further stroke attacks. Dr. Madhusudan, would you like to take this?
Yeah, more than genetic, I think we have to look into the other risk factors that we have been discussing, like obesity, inactivity, uncontrolled diabetes, uncontrolled hypertension, lifestyle. He has been a businessman. We may not know how well he has been managing his stress and how many hours he is spending for himself, like for his physical activity, or whether he is doing any yoga or exercise. That is what is more important, because more than yes, that is been a risk, genetic risk for stroke, in both in hemorrhagic stroke and also in ischemic stroke. In hemorrhagic stroke, we have this called berry aneurysms, which are associated with some form of diseases like polycystic kidney disease, which can run in families, which can also be genetic or autosomal dominant, what we call it as. And there in ischemic stroke, there are certain conditions like polycythemia, which are genetically transmitted diseases. But the portion of those things are very minimal compared to the actual risk factors that are present. So if your father is having a recurrent stroke at 65 years old, first what are we are going to see is the modifiable risk factors that are present. Only then we are going to the genetically determined risk factors. Mostly these genetically determined strokes happens at an younger age, like 20 to 40. So your father having a recurrent stroke at the age of 65, definitely you have to go through his lifestyle, eating habits, sleeping habits, and diabetes, hypertension, any smoking or drinking habit. These modifiable risk factors are the main things that are going to cause stroke. And when it comes to you, don't get anxious that if your father is having a stroke, you are definitely not going to having a stroke. So just take that anxiety out of you. Main thing, have your father as a model, and you need to have an active lifestyle. So from now on, have an active lifestyle, take a balanced diet, do regular physical exercises, do yoga and meditation to have a good mental well-being and stress-free life. That is what is more important than and going and doing complicated genetic tests to determine whether you have a genetic susceptibility for having stroke.
Yeah, there are actually quite a few questions where people are asking that what should they do to avoid future occurrence of stroke. I mean, that is the question which is repeating. And also, if there is any test which one can take to find out if one has inherited risk of stroke. This is maybe Dr. Divya, you could assuage the fears. People want to know whether they can take whether they can undertake any test to find out if they've inherited the genetic risk.
Yeah, there are tests like thrombotic check panel and genetics tests, even your whole exome sequencing available. But there is no need to panic. Everybody comes and asking for genetic test even without any symptoms. First, as Sir told, we have to control the modifiable risk factors. Then, if we had first episode of attack, then we can go on for these tests. Unnecessary to check for everyone.
Kamish wants to know that the symptoms that all of you have mentioned in your presentations today, like how long do these symptoms continue before doing a critical damage? Like, does it start, say, hours or days or weeks before?
No, it starts all of a sudden. Any sudden neurological deficits, if you notice, think it as a stroke unless proved otherwise. So the moment you recognize any of these symptoms, you think it as a stroke and reach the hospital.
Do you want to add something, Dr. Subramanian? Okay, sorry, I heard. So, is maybe you could take this. Is there any Anand is asking whether there is any stroke prevention vaccine available?
So there is no vaccine available to prevent stroke. You have to identify the risk factors and then control your risk factors. That is the best way to prevent stroke. There is no vaccine available to prevent stroke.
Bashir Ahmed says he has numbness in the left foot for 2 to 3 minutes after waking up, which subsides afterwards on its own, perhaps. So, wants to know what is to be done for this and if he has to fear anything.
Now, the thing that goes on itself within 2 to 3 minutes, just consult your doctor whether it is related to your peripheral neuropathy or anything like that, and then get clear. Usually, stroke will go on beyond this time.
Dr. Madhusudan, there's a question for you from Sadakadullah. Okay, he says, please throw more light on precautions, if any, when one is taking blood thinners, because without blood thinners, the heart is at risk. And again, related question, somebody's mother is on blood thinner for past 5 years. So though you have mentioned it, but I think a reiteration is needed. What are the precautions and regular health check that one needs to take to ensure that a person is stroke safe?
Yeah, most of the people we have seen lot and lot of people are being started on blood thinners like ecosprin, pillar for cardiac diseases because cardiac diseases are so common like stroke. They are more common than stroke. So a lot of people are started on blood thinners. So as a neurosurgeon and a neurologist, we have seen lot of patients who are developing brain bleeding secondary to blood thinners. So what are the precautions on your aspect, patient's aspect, what we are going to do? That is what this question is. One thing, as a patient, any trivial trauma has to be avoided. So how to do that? So we always advise old age people, they could have got gait problems, they could have got sensory problems, so difficulty in holding the slippers. So even minute things that hold. So if they have a sensory neuropathy that we call, if they have a difficulty in balancing sensory problems, even their slippers has to be changed to that with a strap on. That is a simple thing. So it will prevent any slippage of slippers and slipping of toes. Second thing, we have to modify the environment to avoid. So if there are old age people like we have father, mother who are above 60 or 70 who are on blood thinners or anticoagulants, we have to modify our environment also. Like we should not have steps in the restroom, and however even the tiles in the restroom has to be in such a way that they do not hold water for a long time because a slip and fall can precipitate a brain bleed. And patient aspects, if they are on anticoagulants, they have to do this coagulation test once in 2 to 3 months, consult their cardiologist and know whether it is in the reference range. If it is going above the reference range, it can cause bleeding inside the brain. And as a part of duty for the physician also, we have seen a lot of doctors, even some general practitioners previously, if you are having a diabetes or a hypertension or any small vessel changes, they do an MRI or CT and we find a lot of small vessel changes, immediately we start them on antiplatelets. So it is a responsibility on the physician as such for not to start immediately on antiplatelets just like that. So previously they had an indication like whoever are above 40 with more or 3 or 4 more risk factors, we are starting on antiplatelets, and we have seen a lot of complications arising because of antiplatelets. So this is for the physician aspect. Don't start just like that on patient on blood thinners. If it is really indicated, we have to start on blood thinners. And the patients who are taking on blood thinners, it's your responsibility to avoid any form of trauma. So be careful. So plan your work so that you don't rush to do things. So we will avoid self-injury, self-fall, we can avoid. And as a family members, we can design the environment in such a way that we can avoid injuries in the elderly.
Yeah, I think anxiety always overrules because, like somebody is saying that if one has undergone coronary bypass surgery, so does it mean that they are prone to stroke? And then again, the same thing I think is getting repeated. What precautions need to be taken, which you have already explained. But Dr. Divya, would you like to say whether they're at a greater risk, those who have undergone coronary bypass surgery?
Yeah, the vascular risk factors are same for the entire body. You know, when one brain vessel get affected, even before that, two heart vessels already would have affected. That was the same. So this uncontrolled sugar, blood pressure, cholesterol, all these affects both heart vessels as well as brain vessels. So the risk is same for both. So blood thinners are safe and safe for the people with ischemic stroke. Only for the hemorrhagic stroke, we said a word of caution. So no need to worry much on blood thinners. They should not stop the blood thinners actually. For really indicated patients, they should continue the blood thinners. I think they
Dr.
are anxious about
Sorry.
blood thinners. They should not stop it, thinking that blood thinners will create bleeding for all. As sir told, they have to be cautious, avoiding trivial traumas, etc.
Dr. Subramanian, I'm combining a couple of questions because people also want to know that if a one-time symptom indicates stroke, like somebody's right, Harsh Gupta says he has throbbing headaches. No, sorry, he has frequent throbbing headaches. So does it have any long-term effects or increases his chances of a stroke? Likewise, Kumar John is saying that his wife, who's 55 years old, she fell down and she has spondylitis, but she recovered. But is it a symptom of stroke? Dr. Subramanian is not there? Okay, Dr. Madhusudanan or Dr. Divya, would you like to answer that?
Yeah. Uh, Come again. Just a trivial fall, and then she immediately recovered.
Yeah. So basically, if it's a one-time fall, so do people have to again get worried whether it's a symptom of stroke?
Stroke will
Uh,
get away immediately. The symptoms will last. At least for an hour, it will last in a transient ischemic attack also, or 15 to 20 minutes in a transient ischemic attack for the minimum time, I'm saying. So just a fall and then recovering on their own, just have a visit to the doctor, but it need not be stroke all the time.
okay. And what about this frequent throbbing headaches?
Yeah, frequent throbbing headaches, they really have to consult a doctor, and if they are advised to take a scan, it would be better.
Okay. Has Dr. Subramanian fallen off the radar? I can't see him. Anyway, Dr. Madhusudanan, does hypoglycemia mimic the symptoms of stroke? Balakrishna Pallikala is asking.
Yeah, yeah. People diabetes who are on insulin or oral hypoglycemic agents, they have to be very careful because hypoglycemic symptoms like they can become unconscious. They can become unconscious, but before becoming unconscious, they can develop this autonomic symptoms. They can have profuse sweating, and they have these palpitations before becoming unconscious. So it can mimic. So what we say is that is a silent thing. That is a more benign thing. So it can mimic a stroke. It can mimic a stroke. So whenever a patient with suspected with loss of consciousness comes to our emergency department, we always check the blood sugar first. Blood sugar, whether they are on oral hypoglycemic agents, or that means tablets, or they are on insulin. So it can mimic a stroke, but we are not worried about the hypoglycemia.
When we talk about recovery, Sudarshan Venkataya is asking, do the brain cells fully recover? Dr. Divya?
Yeah. If
Do,
we,
do brain cells fully recover after a stroke when we talk about healing or recovery?
as early as possible, if we treat, there is a chance of full recovery. As I said, I showed in the picture, the area, salvageable area, if it is more, we can save them.
So people who are affected by a stroke, do they have any behavioral changes? Like, are they prone to more anger, more irritation, more tension?
It depends on the area of the brain that is affected. More often, they get depression symptoms, so they express themselves as anger outbursts like that. Because they will be the earning member of the family, suddenly they have lost their career due to the stroke deficits. So that may be a reason for depression and anger outbursts.
Right. I can see Dr. Subramanian back, so maybe I'll direct the next 2-3 questions to you, sir. Again, is there any pill that can be given when we notice symptoms of stroke in a person while we are rushing them to the hospital?
Yeah, see, it is not like chest pain, heart attack, where you give aspirin and statins. So we have to find out what the cause is, whether it is due to block in the vessel or is it an hemorrhagic stroke. Sometimes hemorrhagic stroke can occur without headache. So very difficult to differentiate. So it is better to do a scan and then take pills. So there is no pills to take at home when you suspect stroke.
So, not all strokes present with seizures, I guess.
Yes, only most of the hemorrhagic strokes they present with seizures.
And also that stroke and heart attack, they kind of share similar risk factors, but you've already explained that they exhibit different symptoms and consequences. But no, there are questions which people are linking and asking how to stay safe. So if you could quickly once again recapitulate.
Okay. See, both heart as well as brain, it is the vascular disease. So the pathology is the same. So the risk factors are the same. Suppose if one has a heart attack or a coronary artery disease, there are chances that they can have neck vessel disease. So the incidence of stroke rises when you have a heart issues. And indirectly also, when your heart is not pumping effectively, uh, there may be some clot formation in the heart which can go to the brain. We call it as embolic stroke. Then if there is any rhythm abnormalities in the heart, we commonly call it as atrial fibrillation. So which can also produce stroke because the atria is not going to contract. You may have a clot formation in the atria, which again goes to the peripheral arteries, and you can get a stroke. So many times both coexist. So we have to evaluate which is, severe, how to attend to that. Sometimes if you have a carotid artery disease, we can do a stenting. If there is a significant stenosis, we can do a stenting, which is available now, which we are doing it widely. And sometimes if the patient opts for a surgery to remove the block at the neck level, there are surgeries available, called as endarterectomy. We can do that. So these are all the procedures available to prevent stroke, especially when the block is at the neck level.
So people are worried, of course, and kind of connecting it to their maybe the ailing, the health condition they have. Like Subhashri is asking, people undergoing dialysis, are they prone to stroke? Then should one be worried about ice pick headaches, which occur frequently? Then if somebody is having myasthenia gravis, then and what is the possibility? Sorry, what is the possibility of the person having myasthenia gravis if the person is already under treatment of strokes? So maybe Dr. Madhusudan, you would
Yeah,
like to? Yeah, yes, sir. So please go ahead.
With renal failure, when you have a chronic kidney disease, the chances for getting an ischemic stroke as well as hemorrhagic stroke is high. So they can have associated atherosclerosis, and then they can have platelet function abnormality. So the risk of coagulation abnormality is also high. Sometimes the risk of bleeding is also high. We have to use drugs very cautiously when you are dealing with renal failure. And too many blood thinners has to be avoided. We have to periodically check and give. And then regarding myasthenia gravis and stroke, okay. So generally we use high dose statins for stroke as well as for the heart issues like heart attacks. So these drugs tend to produce problems in myasthenia gravis. So we need to find out how to optimally use these drugs, whether it is definitely indicated or do we have an alternative. That we had to discuss with the cardiologist and then we have to modify that. It is not very safe to take statins when you have severe myasthenia gravis and then who have repeatedly gone in for myasthenic crisis. So mild form of myasthenia gravis, like ocular myasthenia form or a mild form of generalized disease, maybe if they have very high risk, we can use low dose statins. But it is always better to avoid statins in patients with myasthenia.
As doctors, what challenges do you face in managing a stroke patient? Like somebody has quite rightly pointed out, Ramya, she says when a patient comes to the hospital after seeing the symptoms, soon after waking up, but the patient may have actually gone to bed at a normal time. So that 4.5 hours, that golden period that you have mentioned. So how do you consider that for management?
So it's already discussed by Sir. As wake-up strokes, we do MRI scans where we can find a mismatch between the perfusion and diffusion images. There we can assess the time of, once the time window is gone, then we go for tissue window. That time we can proceed on for further interventions.
So are there any new interventions in treatment modality and how expensive is the treatment for stroke?
Yeah, first is, as I said, it's a IV injection. It's called a thrombolytic agent, RTPA, that costs around 40,000 to 50,000. And the next procedure, if it fails or the time window is more than 4.5 hours, the next procedure will be a mechanical thrombectomy, and that costs around 2 to 3 lakhs maybe. This is approximate cost. So all these interventions, even these drugs are available in government hospitals also.
Okay, thank you. So I would like to all three of you to quickly wrap up the day's session, tomorrow being the World Stroke Day. If you have any 30-second message to give to our audience, please do. We'll start with you, Dr. Subramanian.
Act fast when you suspect stroke.
Dr. Madhusudan.
It's a combined responsibility that I would like the people to. It's your responsibility to identify fast and come fast. And it's our responsibility to initiate our treatment very fastly. And the second most important thing is I want the people to be aware, but not to be very anxious. So that's what happens. So a lot of these awareness programs creates awareness. And in fact, for many people, it creates a lot of anxiety also. So once your anxiety levels goes up, oh my God, I'm going to have a stroke. Oh my God, I'm going to have a heart attack. That stress itself is not good for you. So be aware. It's a very thin line, but be aware, but not get too anxious.
Dr. Divya.
Yeah, to be stay active from the childhood period and pull in your family members to be active and engage in some form of exercise or a minimal walking at least for 30 to 45 minutes a day. That will prevent the major vascular risk factors, be it a heart attack or brain attack, whatever it is. So stay active and healthy, and eat proper diet and have proper sleep. Main thing what we are seeing nowadays in our OPDs, full of stress levels. Whatever the job they are doing, they have high amount of stress levels. So try to reduce your stress levels by doing some yoga or meditation, whatever the way you can bring out your stress. Either it could be exercise or some sports or whatever it be. reduce your stress levels, and be happy and stay safe.
Thank you, Dr. Subramanian, Dr. Madhusudan, and Dr. Divya for sparing your time and helping to raise awareness about stroke on the eve of World Stroke Day. To be fast in responding is the most effective way to deal with recovery from a stroke, and for that, one needs to be aware of and know the most common symptoms. And I'm sure our panelists from Kauvery Hospital filled in all the gaps in information and have left our audience with enough takeaways. And thank you, audience, for sending in your questions. It really helped to broad base the discussion on an important topic. So today's webinar on stroke awareness, recognize the signs, respond in time, was presented by Kauvery Hospital in collaboration with The Hindu under its wellness series. I thank you all once again for joining in.
Thank you, madam.
Thank you.